Governor Asa Hutchinson's newly appointed COVID-19 Winter Task Force meeting for the first time this morning. Its job to look into ways to keep the state's hospitals from becoming overwhelmed as coronavirus cases continue to surge all across the state. 5 News reporter Veronica Ortega spoke to some of the members about that first meeting.
It was a productive first day for members of the governor's COVID-19 Winter Task Force that gathered virtually from all across the state.
It was a good meeting. It went as I would expect. The governor gave the task force a charge. He's divided the task force up into several select committees that will focus on specific areas.
While the task force didn't provide the governor any recommendations yet, Hutchinson made one thing very clear.
It wasn't a time to solicit opinions, but the governor made it very clear that the tempo for the task force needed to be on an accelerated pace.
Task force members say the trend of COVID-19 cases and hospitalizations is not good right now. They say in the last day or two, the Northwest Arkansas region has seen inpatient COVID positive patients in the mid-80s.
We've seen about a 40 to 50% increase in the number of COVID positive patients needing care in Northwest Arkansas.
A spokesperson for Mercy Fort Smith says there are 13 isolation rooms in ICU and 44 other beds for med-surg. At this time, 12 patients with COVID are in the ICU at the hospital and 26 others in COVID units.
I feel like this next couple, 3 weeks is going to be really important. And we really need to do what we can to be sure we can keep the rate of growth of inpatients needing hospitalization under control.
While there are enough resources and space available right now, the task force is trying to prevent that from changing. In Fayetteville, covering news where you live, Veronica Ortega, 5 News.
Subcommittees are planning to meet again this week. Now, the entire task force expected to meet with the governor by the end of this week or early next week.